We'd like to welcome you to the Healthcare Revolution podcast, where we empower you to take control of your health, restore your trust in the medical system, and achieve lasting wellness. I am your host, Brad Powell, Doctor of Physical Therapy and owner of an award-winning foundation physical therapy here in the Salt Lake Valley. Each episode, we dive into all things rehab prevention, overall health, bringing you expert insights from leaders across the healthcare fields. Please note, while we aim to provide with the best knowledge and advice, the opinions shared represent those of experts in the field and are not to be replaced with professional medical advice. So let's revolutionize healthcare and wellness together. Welcome to the Healthcare Revolution podcast. Today I have with me Jonathan Ellsworth, who is the founder of BLISTER. And if you don't know what BLISTER is, you gotta know. Insurance, do they have your back? That's the question of this podcast. This is literally the best insurance policy that you can get. Zero deductibles. Like, this is just an incredible offering right now. And there's not a lot of people that know. We want to spread awareness about what it's all about. So welcome, Jonathan, to the podcast.
Thank you, Brad. I'm really happy to be here.
Super excited to have you on. Tell us a little bit about your background as an athlete and kind of how this all started.
Well, I grew up in Chicago, and so I was a guy who, as I put it, I cared about football and basketball and not a third thing. That really was my world, and so was very much coming from a kind of mainstream sports background. Had a very significant injury, actually, that shut down a college football and basketball career, and which is really interesting, right? I think for all these kind of mainstream sports, like even if you play at the highest level, most of the time that career is over by the time you're like, I don't know, 28. I had done a little bit of skiing, not much during that phase, but really during my undergraduate years of college, started skiing more. It was really, this sounds dumb, but it was really eye-opening to me that, like, wait a minute, if you're a skier or a mountain biker or a climber, you just get to do these things forever. You know, whereas like thinking about nobody's really playing football, right? Or I mean, you can play in some guy's rec league or something, basketball. So that was honestly unbelievably attractive to me. And I started gravitating toward these kind of outdoor sports, moved to northern New Mexico in 2002. And that is when this became, I'd say, the kind of outdoor sports stuff became very much a way of life for me. So that's a bit of the background. You know, I'm kind of a decent mainstream sports guy, getting involved in all, like, again, trail running, climbing, mountain biking, skiing. And I knew the right gear would really help me progress in these sports and just enjoy these sports more. And as I was kind of looking around, trying to figure out, you know, what would be the right ski for me to get, I was like, why does the product information, the product reviews about all of this pretty expensive outdoor equipment, why does it seem so bad? And the more I learned about the kind of state of gear reviews in the outdoor media landscape, I learned that a lot of this stuff was pretty pay to play, and that often not much actual reviewing, much time on snow, much time on the trail was actually taking place.
Who's actually testing this equipment?
Yeah, and are they even testing it? And then are they telling you the truth about this stuff? And when I learned that, you know, many of the gear reviews in the outdoor world, they were often tied to sponsorships with the very, you know, ad packages with the very gear manufacturers whose product they were allegedly reviewing, I was pretty scandalized by that. I was kind of like, wait, you're just kind of lying to the whole community of skiers or mountain bikers, you know, what have you. And that's when I decided to start BLISTER. And I thought, we're going to do this different. We're going to go really in depth. We're going to put a ton of time on the gear before we write about it. And we're just going to try to do the best possible consumer product information we can. And we're not going to take any money from the gear manufacturers we review to just eliminate that deep conflict of interest that we were seeing in most other review outlets.
Start as a healthcare plan. This started as you're an athlete, you're out doing all the outdoor activities, and you
That's right.
have the best gear, and then you want to be able to give that feedback to consumers to improve the quality of the gear that you're getting.
100%. That's where this began back in early 2011.
It's awesome.
Yeah.
As I'm thinking about this healthcare plan, and I definitely want to hear the story and how you evolved. I went through this last week where we looked at all the premiums. We're going through, open enrollment pretty soon here for the company. I'm looking at all the different insurance plans for my employees and selecting the ones that are best for our team. And last year, I had a lot of heartburn because the premiums went up 10%. And what we got paid as providers, the people that are actually providing the service, we had a 3% decrease.
Yeah.
So I had a ton of heartburn. I'm like, why do insurance companies, why did it go up 10%, but yet the people providing the service, it went down 3%? And then just barely, I asked, okay, what's the premiums going up? They went up 14% this year. And we're still at a 3% decrease.
Yeah.
That's 2 years, 24% increase here in Utah in premiums, but yet the people providing the service get paid less. You tell me where that makes sense. So that's why I'm like super intrigued on the health plan that you provide, especially for our high level outdoorsy people that are in different various sports, and how it really protects them. Because the thing is, I pay all this excessive money towards premiums, and then on top of it, we got a $5,000 deductible.
Yeah.
Like it's astronomical now. And it's just getting to the point where as a society, we have to decide, like, this is not where we want to go. It's 24% in 2 years is absolutely ridiculous.
Yep.
I don't even know how they're getting away with it, but we got to go another direction. That's why I love your plan. So tell us how this evolved from, gear to all of a sudden creating a healthcare plan.
The origin story, which I think is really important to this. I became that person, living in northern New Mexico. I'm outside on a mountain bike or, on a pair of skis most every single day of the year. As we start Blister, now we have this team of reviewers who are doing the exact same thing. And then we have our whole network of friends. I started Blister at Taos Ski Valley, and everybody there is kind of getting after it themselves. And then what happens inevitably when you do these mountain sports? You get hurt.
What we talked about, I raced motocross,
Yeah.
To the professional level, and broken over 30 bones, and it's inevitable if you are pushing yourself at a really high rate as an athlete in these various sports. You will get hurt. It's just part of the nature of the sport. And sedentarism, you create more problems.
That's right.
It's something you're trading off.
But by the way, one of the things I want to say early on here is Blister Plus isn't only smart for the person getting out there most days of the year or the highest level athletes. You know who else it works well for? The newbies. The person who's only actually able, because of maybe where they live or their busy lives and schedules, who maybe are only skiing or on a snowboard 10 days a year. You know what? They're probably dealing with the same high deductibles that you and I are. So this is like our plan doesn't care if you're really good at these things or an intermediate or brand new to these sports. The injuries happen at all the levels. And that's really something I want to drive home, because I've had some people be like, oh yeah, I'm going to definitely let all of the most extreme people I know, let them know about this product. And I'm like, you should probably also tell that person in your neighborhood who is like, I'm going to start snowboarding this year.
It's great. I love that so much. Because the thing is, when people look at these plans, they're like, well, I'm not a high-level athlete. I'm not in Patagonia skiing. I'm not traveling across the world for these different things. I'm not skiing 50 times a year, but these are for people that are just doing any of these outdoor things. If you're just a hiker, right?
Yeah, that's right.
This is a great plan for you. I mean, and we'll talk about the affordability of it and what the value that it really creates. But man, I love what you're saying. It's for everyone.
Back to your question of so how did we go down this road? I mean, I can talk about a couple of very personal anecdotes. One, 2017, it was actually my birthday. It was in July. And so some friends of mine were like, hey, let's go skiing in the dead of summer, right? And so we head over with a bunch of my good friends to Independence Pass, just between Crested Butte and Aspen. And I'm wearing a ridiculous unicorn t-shirt. This is we're just out there, having a ball. And long story short, some snowpack blows out as I'm hiking back up a backcountry line. I go for a ride, get sent over a cliff. It's July, so there's no snow. We're skiing like a strip of snow. I go off this cliff, get knocked out. My friends are just watching me ragdoll down straight rock, see me laying unconscious at the bottom of the line and think I'm dead. Fortunately, not dead, but we're on a pretty steep section of mountain. One of my friends who's a doctor was really worried about internal bleeding. We can't land a helicopter there. So he's like, you're going to have to walk out. I can't walk. It takes me about 2 hours to even be able to attempt that. We get down to the bottom, though. I make it off. And, I get to the bottom. My friends had called an ambulance. I get checked out by 2 EMTs, and they're like, you're a mess. I mean, I'm just a complete bloody mess. And they're like, we can't force you to come to the hospital with us right now, but you should 100% come to the hospital with us right now. I turned down that ambulance ride because I didn't know the state of my health insurance at the time. Went home and I thought, well, I was able to walk off the mountain. I am bludgeoned. I mean, this is real bad. I am bludgeoned. I'm a mess. But I'm like, maybe I dodged the bullet and maybe I'm all right. And I'm like, I'm going to go home and if, I'll go to a hospital later if I'm like, this doesn't start feeling better. 5 days later, nothing is feeling better, only worse. I finally go to an emergency room. They put me in an MRI. As I'm coming out of the tube, there is a team of nurses standing there with looking wide-eyed at me. And they're like, you've torn 3 of the 4 ligaments of your neck. You've crushed your C6, C7. You have radical cervical instability. The fact that you're not paralyzed right now is insane.
Yeah.
You're going to surgery right now. So there is one very personal. And so today, I probably should be paralyzed.
You're lucky. That's
Why didn't I go? Because I didn't know the status of my health insurance. And I know that there are many people in my situation who don't seek medical treatment because they're not sure they can handle the bills. That's just one of the anecdotes.
I had a ton of examples like that. I'd be in a terrible accident racing motocross, and I'd always tell people, do not put me on an ambulance.
Yep.
Do not be on an ambulance because I don't know what that bill's going to look like 3 months later.
Yep.
I don't care if you got to haul me off. I can't tell you how many times I've been to the ER in the bed of a truck. Throw me in the bed of the truck. I'm not going in an ambulance. Yeah. You know what I mean? And I'll do everything in my power to avoid the emergency room because I know the huge bills.
Yep.
I'll just wait and I'll go to Instacare in 3 days. One time I broke both my arms, went over the handlebars, took huge chunks out of my knees, and it was out in Canesville, Utah. Amazing place to ride. But I got home and I had 2 broken arms, and I didn't even go to Instacare for 3 days because I'm like, well, I'm going to go to the ER. They're going to tell me my arms are broken, but they're all swollen, and then I'll be there for 6 hours, just miserable. It's just like a miserable process, and then they'll send me home in some soft casts, and then I'll go to the orthopedist, and then I'll get cast. So let's just cut out all that bull crap. I don't have to pay the bill, and I'll just go to the ortho doc, 4 days later when swelling goes down. So I knew the process, and I didn't want to pay the bill. So I totally on the same page with you. There's just too many unexpecteds that you can't control, and you don't want to get these giant bills. But there are some huge ramifications that you'll run into if you don't go to the ER.
Yeah.
Like yours, that you could have been paralyzed for the rest of your life. That's wild.
Yeah, and I mean, your story nails it. I mean, when you're telling people, don't ever put me in an ambulance, this is so messed up. And I'm sitting here I totally understand why you say that. And how messed up is this, right? In modern American society, where we are a well-off country, supposed to have all these nice things, this is what we're doing for, active people who are kind of doing the right thing about we're not sedentary. We're not just sitting around playing video games all days. We're doing the thing we're supposed to, right? We're outdoors. We're enjoying the sunlight. We're out with our friends. And we're saying if anything happens, don't send us to get medical treatment. It's a broken system. And I've got more anecdotes along these lines, but I think, to maybe keep it moving, I think Your story, my story, everybody's got these stories, or we know people that have similar stories. This is a system we have got to fix for those of us, and let's just focus in right now on kind of the outdoor sports industry, but those of us who love to be outside skiing, trail running, snowboarding, mountain biking, road biking, etc. We got to fix this and kind of take care of our own. And that's what we're trying to do with Blister Plus.
I love it. I love it so much. So tell me about, if you were just kind of summarize Blister Plus for the consumer and what value it adds to them. Tell me all the things you'd say.
Yeah. So right now, we're talking September 19th, 2025. We currently have with Blister Plus 30 activities that are covered. And this is an activities-based insurance program. And I think that's really, really important for people to understand. So as of this recording, unfortunately, like motocross is not covered. We are working on this, but we're trying to just be as clear with people as possible. So motocross is not covered, but let's say skiing and snowboarding, those two activities are covered everywhere on planet Earth. There are no exceptions to this. So we see this with a lot of other insurance policies. It's like, yeah, we'll cover skiing and riding, but not off-piste. And I'm like, what? That's not real. Like, our people, we're always in the backcountry. If you are hiking anywhere in the world, camping, I don't care if it's a road bike, a gravel bike, a mountain bike. I don't care if you're on like your little townie biking to the post office. These activities are covered, and you don't have to wonder about, well, is there that exception? Is there that gotcha? Like, you were off piste or you were in the backcountry. No, that's not a thing. We've worked hard to eliminate all those, I call them the gotcha exceptions, that we are rightly nervous about with every other form of insurance out there. Because it always feels like they're playing that gotcha game with you. We have set this up in a way where you don't have to worry about that. The two rules with Blister Plus, from the way we have it set up: don't be drunk, don't be intoxicated. I tell you folks, no insurance company out there, if you're like, yeah, I was skiing along, but I was hammered and I smashed into a tree, you're not going to get covered. Nobody's doing that for you. Yeah. The other rule is don't be doing something illegal. So it's just like check exactly what activities are covered. They're all laid out, on our landing page. And if you're like, I do those things all the time, or I do some of these things occasionally, given how high most of our deductibles are, my personal deductible, I have a $7,000 deductible. So anything happens to me on my mountain bike or skiing, I know if I go get medical care, I'm at least paying $7,000 out of pocket. Now with Blister Plus, that same injury, I'm paying $0, right?
We're talking less than $400 a year.
Yeah.
For this plan.
Yeah.
Right? So and you get $25,000 worth of coverage. Mm-hmm. So I had a buddy that he's 75. He was up skiing. Just super outdoorsy guy. It's just crazy how much stuff he does, but he's not stopping. But he was up skiing and broke his femur. He just had a torsional rotation with his ski as he was coming over a hill, and it literally had a spiral turn on his femur and shattered his femur, right? And then he had to get emergency trauma surgery to get a rod put in that. And his bill was around, his deductible, I think, was maybe $7,000. And of course he met that. And then there's the other costs that come along with it, the co-insurance, all those things. Yep. So you're telling me this all would have been covered. $400 a year, covered up to $25,000. His surgery, his MRI, his emergency room visit, toboggan ride, whatever else there is, all that would have been covered, right?
Yeah. The way that the simplest way we talk about it is if you get injured and like an acute injury, you go down, you crash, you roll an ankle and compound fracture your ankle. It's kind of an acute injury. Doing one of the 30 covered activities, that automatically triggers a bucket of $25,000 that can go toward medical assessments, medical treatments, medical transport, and importantly for a lot of us, backcountry evacuations. So to be very clear, so the cost of the program is $395 for 365 days of coverage, right?
That's ridiculous what you've done here.
But there is a hard cap of that $25,000, but this is now per incident. Actually, I was just mountain biking with my girlfriend 2 nights ago. This is true, on our favorite go-to after-work mountain bike ride. It's kind of a spicy ride. It's pretty technical, but we know it like the back of our hand. I don't know what happened, but it happens when you mountain bike sometimes. She went over the bars, smashed up her knees real bad, and we're really hoping she didn't break one of her kneecaps. She has Blister Plus, and so she'll go in, get an MRI. That will be totally covered. She'll pay $0 for this, right?
If you pay cash just for an MRI alone, that's $400.
Yeah.
So
it's usually more than that.
MRI, you already got your whole bases covered.
Yeah. So this accident she just had Wednesday night, she's got that triggered that bucket of $25,000 to cover medical assessments, medical treatment. Now, let's hope she's fine. And I really, really hope she's fine. 4 weeks from now, if we're backcountry skiing somewhere, and God forbid, but something happens while we're out, that is a new incident. So that triggers a new bucket of $25,000 of coverage. So again, for those of us who are always out there doing something, this is where this becomes this becomes absolutely a no-brainer.
Yeah. I mean, obviously this was moto, but I was out in the hills a couple years ago, and we were doing a 100-mile loop. And, say we're out backpacking instead, and you fall off a cliff or you break an ankle and you're 50 miles in, right? I broke both my wrists and had to ride back, but everyone was worried about, we need to call Life Flight. I was knocked out for 5 minutes, unconscious. This, if it wasn't moto and say it was backpacking or hiking or whatever it is, that Life Flight would have been covered, right?
Up to $25,000. And so again, it's important for people to understand kind of every injury that happens with this. There is that hard cap of $25,000. But this is also, folks, why the thing is only $395 for a year of coverage and on a per incident basis. So
can people use kind of essentially double dip? Can they meeting their deductible at the same time? So like they pay $400 and maybe they hard cap at $25,000. Is that $25,000 also then applied to their deductible for their health insurance plan?
100%. And this is what.
Gosh. So mind blown here. This is incredible.
Brad, you're awfully sharp for a guy that's blown up as much on a dirt bike as you. Like, you're sharp. This is one of the insanely great things about this. So, I should say, if you have no health insurance at all, which unfortunately is a whole lot of people in the outdoor community, Blister Plus works as a standalone product. You do not have to have another form of insurance. But to be very clear, if you get in a car accident, Blister Plus does not help you there. We want people to get on some form of insurance, but when you do have, let's say my not very good traditional health insurance, when that's supplemented with Blister Plus for the reasons you're hitting on, Brad, this works incredibly well. So I was talking to somebody the other day who has a $16,000 deductible. With Blister Plus, they get hurt doing one of the covered activities. Blister Plus comes in and it covers the $16,000 deductible. Then their regular insurance can come in to cover other stuff. But here's another thing we're learning. Traditional health insurance is just simply covering less and less physical therapy. So somebody who's out there who's like, well, I only have, say, $1,000 deductible or $2,000 deductible, so I don't need Blister Plus. I'm like, cool. When something happens to you and you're going to your physical therapy sessions, be prepared for your traditional health insurance to inform you that they're going to cover maybe 1 or 2 or 3 sessions.
It drives me nuts, Jonathan. We'll get someone that will come in, acute ankle sprain, right?
Yeah.
And We treat them for maybe 10 visits, send them on their way. 3 months later, they're super active. They go, hurt their knee. They come in for 5-6 visits, right? And then, a few months later, they actually fracture their shoulder, right? Their humerus or something. And they've maxed out all of their PT benefit for the year. And the insurance is like, sorry. But literally, you need therapy for that shoulder. You're getting surgery for it, whatever, But it drives me crazy because their benefit is maxed out. So you're saying they could have maxed out benefits with their insurance, but it's unlimited PT up to $25,000 for any additional injuries that you might have through the year, regardless of what insurance says. This is incredible, John. Like, well done, my man. This is so cool. So tell me, we talked earlier about, there's about 5,000 people on this plan. And the word gets out, this is going to catch wildfire, right? My concern as a business owner, and we talked about this earlier, is like, there is this threshold. If there's too many claims, essentially underwriting will come in and say, you need to raise your premiums. We deal with this with HOAs. We deal with this with, health insurance. Like, premiums continue to go up. It only stays low for so long, right? But your vision as the founder, and let's keep that as low as we can. We don't want to decrease that. Tell me, what are things that would increase that premium over time?
Yeah, I mean, it's a pretty simple ratio right now, but it's one that I'm working like mad to, try to stave off those premium increases. But basically, the underwriter of the Blister Plus policy. So as of today, Mutual of Omaha is the underwriter of the Blister Plus policy. I created the Blister Plus policy, said we're going to cover for now these specific activities. I want it to be $0 deductible. I want any resident or any citizen anywhere on earth to be able to sign up for this. So if you are Canadian, you can get Blister Plus. We have Blister Plus members in New Zealand, in Austria, in France, in Europe, in Kazakhstan, because the product works. So there's a bunch of every policy you're creating, and it was important. I want a $0 deductible. So that's all the stuff we have right now. It only covers certain activities, right? 30 activities at the moment. And we were just looking at our Blister audience. So we've got a ton of skiers and snowboarders and trail runners and hikers, backpackers, campers, rafters, kayakers. So we've got these current 30 activities. But now what happens is, injury claims have been coming in, right? The underwriter is just looking at how are they making money on the policy versus what they're paying out in injury claims every year. And that's a ratio. So far, they've liked the ratio. So far, we've been able to stave off and avoid these premium hikes. But the only way we are going to be able to continue to do that is continue to get the word out about Blister Plus. And my goal is that every single human being who skis, that mountain bikes, that snowboards, that they at least know that this exists, they understand how it works, and they can just do their own assessment. Would this benefit me? And if the answer is yes, we need to get those people signed up immediately, because we need to grow that pool, because the injury claims...
bigger, the more you can keep the claims down, because you have all these people throwing money into the pile. It's $400, $395, into this pile, and it grows, and then it supports more of that claim. Here in Utah, we have Christian health cares, and I think maybe that's across the nation, maybe it's global.
Yeah, it is.
But it's essentially the same idea, right? What's the likelihood of something catastrophic coming into every single person's life? It's minimal, but that's why we have insurance in the first place. But with being active, injuries are inevitable. You will get hurt at some point, and having that coverage is super important. And the thing is, most injuries don't really cost that much.
That's right. Brad.
Cheap. Compared to going, just one emergency room visit is the same as almost a whole plan of care with a physical therapist. And in Utah, we just passed a bill to become primary care providers. So that means we are the entry point. We're the first state in the nation to make this happen. And we're the only state that allows it so far. But we are an entry point for injury and pain because we've saved the healthcare system so much freaking money that it's so clear that legislators were 100% supportive. The bill passed unanimously in the House and the Senate. Like, it was just crazy how much support we were getting. And this plan is like next level for providing the best quality and value for patients. It's incredible.
Thank you. And one of the things I want to say, you asked, like, how do we do this? Like, keep premiums down, which is a huge goal of mine. I don't want the price to go up, but we don't control the premiums. So we need more people signing up. And then another thing we are working on is adding more activities that are covered. So that is a process. And, we get hit up a lot. People saying, hey, cover moto. So we're looking to cover more sports, but it is a dance. And I think the main thing is we have a product that works. And here's another thing that's important. When, Brad, you started this conversation talking about the premium hikes, 10%, 14%. This is kind of the bottom line that I really want people to understand too. Health insurance companies do not care about me and you. We need to get crystal clear. We all pay into these policies so that we allegedly have this coverage when we need them. And then all that happens is we get fought tooth and nail, or we're told these policies aren't actually going to cover our physical therapy. The things we've been paying them to cover, they won't actually cover when it comes time to. I think what's different with Blister Plus is the people at the top of it are doing the same things. We're in the same community. We're here to take care of our own. This is me. I told you my story, how I probably should be paralyzed today. We're trying to take care of ourselves and our own and our community. And if I'm just like, hey, Brad, I found a nice way where you and I can make a ton of money. Let's start offering some insurance plan, and we're just going to jack the rates every year and cover less and less, and we'll be really rich. And it definitely won't be a good thing for the people, like our friends and the people we know, but who cares? That is exactly our current health insurance landscape.
And then they all get together, and they're like, everyone, let's keep raising our premiums because if we all raise them at the same time, people don't have a choice.
No, there's no choice.
And until us as the consumer says, we ain't doing this anymore, 24% in 2 years is outrageous. Like, you can imagine as a business owner, me raising my prices 24% in 2 years. What in the world? Yeah. Like, how are we okay with this? Yeah. Like, there has to be a stance to say, we got to go another route.
Yeah.
I'm paying $1,500 a month in premiums, and then I'm paying $5,000 towards a deductible. Like I had a newborn just over a year ago, and we paid all throughout the year family costs $25,000 worth of healthcare costs for a very healthy baby between premiums, deductible, coinsurance, all copays, all the above, and. Like, obviously, we're not covering babies with Blister Plus. What I'm saying is, like, I could have paid. One of my friends paid cash, had no insurance for a baby. He paid $4,000 cash. Huh. I paid $25,000. I have insurance, right? Like, you tell me the insurance is on my side.
Yeah,
that is a bunch of bullcrap. But it's exactly what you're saying. Like, this is a business for them. They raise the premiums every year with no intent of helping you. And we got to figure out systems that really are working for us. And I love your vision. I love that you guys are in it with the consumer. Like, you're doing it for you. You're doing it for your community. You're doing it to keep prices down to be able to protect people.
Yep. Yeah. I mean, I buy Blister Plus for everybody that works at Blister. We get them Blister Plus, and we're seeing this happen more and more at, ski shops and bike shops. They're doing this because their people are out all the time doing these things. We've actually seen, too, a really cool development. If you look at the world of, professional athletes, your favorite skier is an independent contractor. these people they get hurt, they are on their own. And what we've started to see is several companies now, actually, interestingly, all with strong bases in Utah, Atomic, Armada, and Solomon are now all covering their global athlete teams with Blister Plus because they've seen it work around the world.
See how much it saves too.
Yeah. And it's what I love about it is these athletes are putting themselves on the line every time they're out there filming or testing new product, doing all the gnarly stuff that we love watching. And then when they get hurt, it's like, oh man, too bad. Thoughts and prayers. That sucks for you. And also, we're probably going to pull your contract because you're hurt now. So this has been a cool development in the outdoor industry, and we want to see more companies better support their athletes in this way that Atomic, Armada, and Solomon have kind of started this. And, just the more you learn about the different pockets of the outdoor industry, this is just another area where we can do better by people and do better by again, our favorite athletes that we sure love watching them do all that risky stuff in the movies every year. And those things, there's serious costs and consequences to what they're up to.
I got this gal, she's preparing for the Olympics, the next Olympics coming up. She's a downhill skier, one of the best in the world. And she's right now in Chile and training. And she's got this back injury from skiing. And she's probably paid in thousands of dollars cash, right? I'd say up to $10,000. Yeah. She would have had this plan. We're talking $395 versus $10,000 out of pocket. Yep. And we got to spread this. This is such good stuff and such good value for all these people. Tell me, I'm the consumer. I get Blister Plus. I sign up today. I go out. I'm skiing at Sundance. Tweak my knee. Mm-hmm. I need to go to PT, get it checked out. How does it work? I go to PT. Do I pay for it out of pocket, submit for reimbursement? How does that work?
So this is one of the things that, because Blister Plus works all around the world, that means it's got to be an extremely flexible program. So this is, frankly, this is one of the massive benefits of the program. Is that you can go walk into any licensed medical provider and you're going to be taken care of, right? The bad news here is that it's hard to say it's every single time. It's just step 1, then step 2, then step 3, right? So the first rule we always say, if you get hurt doing one of the 30 covered activities and you're a Blister Plus member, number 1, go get medical treatment right away. Just go. And depending on the physical therapy center, the emergency room, the urgent care room, the whatever you're going to, if you're skiing in Kazakhstan, just go get it. And each of these, and this also varies kind of state by state, which you kind of alluded to already. So rather than sort of saying it's this every time, step 1, then step 2, then step 3, go get treatment, go get care. In some instances, one of the last times I got hurt, I was at an emergency room and they're like, okay, do you have insurance, traditional insurance? Yes, I do. Okay, slap down a credit card for a copay thing. So I did that. I didn't, in that case, talk about Blister Plus at all. I got checked out, got stuck with a massive bill from one afternoon visit. $12,800 was my visit for my ER bill from an afternoon visit where they just ran tests, CAT scan, MRI, no surgery, no cast, no nothing. What you do is immediately after getting hurt, 1, go get treatment. 2, the first chance you have, you're going to start a claim. Blister Plus members get a welcome email from us, and you're going to go and start a claim. Hey, I got hurt doing one of these activities. That starts the process. And we have partners we work with who know the landscape, right? They'll work with our Blister Plus members to walk you through, okay, where did you get hurt? Okay, you're going to need to get this form of bill and the rest. And that person will start, because in the United States, in many places, you don't just get treatment. Like when I got hurt, had to go to the emergency room, got hit with that bill for $12,800. I didn't get that bill that day. I didn't get that bill for months later, right? Once you get the bill, you'll submit that bill. Our current underwriter, Mutual of Omaha, will then reimburse the medical provider directly.
So you don't even have to pay anything out of pocket.
In certain instances. Now, if I'm skiing in, I don't know, Switzerland, and they're like, you blew your knee, I don't know, let's say an example where they had to do like an emergency surgery, and they're like, but we're not touching you until you pay us in full. All right, take out your credit card or whatever. I don't know, sell some Bitcoin. I don't know what you're going to do. But like whatever they're saying you need to do, make that payment. Get the medical treatment. And then in that case, you'll now submit those bills and you will be reimbursed up to that $25,000 limit for the costs that you had to pay. So I'm sorry if that sounds a little wishy-washy, but I hope people understand it's that inherent flexibility so that this does work. If I get hurt in Switzerland or, skiing in, Japan, or if I get hurt in Utah, right? It works everywhere, but not everywhere has the exact same systems in place.
Yeah. So you need to keep the super bill, keep the receipt, whatever you pay, submit for reimbursement. What's the turnaround with getting reimbursed from Blister Plus?
Yeah, that's going to vary too, to be honest. And a lot of times that depends on how soon are people receiving the bill from the medical provider, which is pretty wild. But again, the last time I was in an ER room, I didn't get the bill for 4 or 5 months. So now I didn't pay anything.
I want to be clear here. As a medical provider, we submit billing same day. Sometimes up to 48 hours later. A lot of people are like, your billing team sucks because I didn't get a bill for 3 months.
Yeah.
Like, my billing team is actually exceptional. They submit it within 48 hours. Who sucks is who you partner with as insurance.
Yeah.
They're the ones saying that it takes my team forever, right? You're getting this wrong idea. Your insurance acts like they're the savior of the world, and they will submit to you like, oh, this was actually what the provider charged, and we actually negotiated a cheaper deal. They didn't negotiate crap. They just said, no, we're not paying that. Here's what we're actually going to pay you. And it to the consumer, it makes it seem like they're the savior. Like they're just doing so much good for me. They're serving me. No, they create so many issues for healthcare providers and for you as the consumer, you have no idea about. You think it's the medical facility, and sometimes it is, especially with hospitals. There's some things that are slowing down. But for a private practice, no, we get those out. If things take a while, it's your insurance that's causing delays, not us.
Yeah. And so, well put, you're in that world. And I understand that it's frustrating. Listeners hearing this, I can't say, oh, within 30 days, you are 100% guaranteed to get like full reimbursement. You know how the system works. This is just not how things are set up. What I can tell you is, to date, and we've been running Blister Plus for 3 years now, we have not had one denied claim. Not one. So
I have 30 as my practice just today from this week. So,
Say that again.
Literally, so I get an email every week of how many denials. Actually, let me rephrase that. It's 60. I have 60 just in my practice. We probably do around 450 visits a week. So out of 450 visits, you do the math, we have 60 that were denied from insurance that we got to go back and fight. But you're telling me you've had 0 in 3 years with 5,000 people.
Yep.
That is absolutely incredible.
So another thing that we're really proud of is, because it is like insurance can get messy and dealing with this, and nobody likes to do it. But what I'm telling you is this product works, and then one of our Blister Plus members has a question, or they're like, hey, I'm not hearing back about something, or I'm confused. They email our team. And normally who ends up going to advocate or trying to figure out what's going on, if there's a hang up or some friction, is me personally. So Blister Plus members have a whole other level of advocacy that I sure as hell have never had with my Blue Cross Blue Shield. So if there's a problem, if there's a question, email us. We are here like working for our community, and it doesn't happen a lot. But a couple times a week, maybe somebody's like, hey, I'm confused. I thought I sent this in, and we can or like we haven't heard back on something. We'll go directly to our partners and I say we, it's usually me. Hey, what's going on here? So, and as we grow that team, we've got extremely smart people working with us on this because we're growing the membership. There will be more questions, so we will grow that team. But I think that's another wild value add to this is when something actually goes wrong for you, which is awful, you're hurt. Now you're also getting faced with getting saddled with expensive medical bills. We are advocates for our members, and that's part of the reason why to date there hasn't been a single denied claim.
There's so many things going through my head, like what does negotiation look like with hospitals? Because there's a cash pay price, right, which is significantly less than the insurance-based price. But I'm just thinking, like, if we converted everyone to this plan and got everyone off of insurance and just did cash pay medical system, how much money would literally be saved?
Yeah.
You literally cut out all these insurance, big administrative teams that are taking home millions and millions, sometimes even billions of dollars. You cut all of that bull crap out. All the denials, all the pre-authorization, all the administrative burden that it causes for my medical team to do extra work. We just eliminate so much waste.
Yep, exactly.
This is just next level stuff. Tell me, why would someone not do this? I'm like looking at the other end. I always try to look from every side. Like, is there any reason why anyone wouldn't want to do this?
Yeah, I think one answer is like, let's say you only were a dirt bike rider. You only did motocross. Well, we don't cover that. It is an activities-based coverage. So step number one, please go look at the covered activities. It is very clearly laid out on our website. And if you're like, I do one of those or two of those or three of those, most of us actually do 5, 6, 7 of the things listed. But if you do one of them, it probably already makes sense for you. Even if you only do one of those things 5 to 10 times a year.
Weightlifting, CrossFit,
No, it is an outdoor sports focused plan. And so that's a good question. Like, well, why don't we have CrossFit covered? Because now you go that broad and anybody gets hurt doing anything, with CrossFit. This plan now is, I don't know, maybe $2,000 a year. We are trying to keep the cost low for the outdoor community. That is where things are today. Yeah.
We're going to post a list of all these activities. We'll post all the different ways to getting into Blister Plus, how you sign up, all the details with it. So we'll include all this in this podcast. But this is incredible stuff. Any other reasons why people would?
Yeah. And we hear these all the time. One of the things we hear is people say, I don't need this. I already have health insurance. People don't even understand deductibles. And I'm not making fun of them. I was one of these people. I used to be one of those people. So there is so much confusion and such a lack of clarity of what we actually have because we hear this a lot still. I don't need this. I already have insurance. People don't know about a deductible, or if they've heard the word, they don't even know what theirs is. Lots of people have never heard the phrase max out of pocket. Lots of people have no idea of all the exceptions and fine print that, I have Colorado-based Blue Cross Blue Shield because I live in Crested Butte. What happens when I go to Canada and I'm skiing in Canada? Am I certain that I have the same coverage in Canada that I do when I'm hurt in Colorado? And the bigger question, dear listener, are you certain? What happens when I go out of state?
You looked at that 60-page document that you signed?
Yeah, there's so much confusion about the coverage we're actually paying for with our traditional health insurance. And then secondly, because of the broken system that we've just spent the last, hour talking about, people just don't trust this stuff. So I think a lot of people are like, yeah, I don't know, it probably doesn't work. And so that's something that we're overcoming, and unfortunately, one of the ways that we're growing the membership is because guess what? The people in our community do get injured. And then it's word of mouth. I got hurt, Blister Plus covered this stuff. And then their friends are like, wait, that actually works? Mm-hmm. So unfortunately, it's like we're in this position of like, people, please sign up for this if you do any of the covered activities. But unfortunately, what's one of the mechanisms is we're still having people in the community get hurt. They get taken care of, and then we can share their testimonials. And what I try to tell everybody is, man, do the math on this. It's $395 a year. You want this before you get injured. Because we still get this sometimes. I get these emails, and they usually start with the word, dude, I was totally going to sign up for Blister Plus. I totally meant to. And I just blew myself up mountain biking. Can I still sign up for Blister Plus and get covered? And I'm like, nope, that's called insurance fraud. And that would sink the whole program.
Yeah, if that's because now you're in a catastrophic injury.
Yeah, no,
you got to pay in.
That's right. You got to
getting health insurance to have a baby, but I'm going to wait to pay premiums until I have the baby.
No.
No, you need to be on the plan. Short-term disability is the same way. If you're not on short-term disability and you're paying the premiums before, you can't just get disabled and be like, oh, I'm going to hurry and sign up for short-term disability.
No, this is
on that before.
Yeah, and this is just common sense, and like we all know
common sense, but obviously you get the questions.
Yeah, and so it's like, come on, people, like let's just do better as a community. And but that's the biggest thing. I still get that email, multiple times a week. Oh man, I just got smashed. Like, can I get Blister Plus now and be covered? Nope, that's insurance fraud. So, these are some of the reasons to answer your question. And I get it. I get the distrust of insurance. I guess I get the anger about traditional insurance. And these are the reasons why I sound so fired up today talking about this. And it's also why we put this program in place, because it is a broken system. And as somebody, very involved in the outdoor industry, doing these sports myself, running all of our podcasts with professional athletes, putting out all these product reviews about this awesome mountain bike we love or ski we love, but then accidents happen. And it just strikes me as extremely irresponsible if we are never willing to talk about or acknowledge the dark side of these sports we love. And that is the dark side is these injuries are inevitable. What we've got here is an opportunity to take better care of the outdoor community. And when the injuries come, at least you're now not also getting financially wrecked.
Because it's already hard enough to be injured, be out of your sport. That identity is so important to people. Yep. It just wrecks you emotionally, psychologically, all the above. You can't do what you want. And then all of a sudden you get this huge bill on top of it. It is a lot. So I love what this is. So as we kind of wrap up this podcast, tell me, how easy is it? I'm going in, I'm signing up today, Jonathan. Like, how easy is it to get on Blister Plus?
If you go to sign up on the site, it will take you less than 3 minutes. The website is blisterreview.com. You can also just go to blisterplus.com. You'll get to the landing page. You will see a clearer layout of everything that's covered, the activities that are covered. But the sign-up process is incredibly simple. There's no set of, do you have pre-existing injuries? You literally are putting in your name, your email address, your credit card payment, and hit the button. You will then get a welcome email from us. Look at that welcome email. There's one more step to set up the kind of claims portal. But that whole process literally is less than 5 minutes from go to the site, name, email address, your billing information, boom. Next step, check your inbox. You're getting a welcome email for us. You'll then do one more step where it's, again, you're going to just go start up a claims portal for if and when you get injured. And that whole thing will take its own 2 minutes. That's it.
That's so incredible. I'm pretty sure I'm your biggest fan here. This is next level stuff. I mean, just thinking about all my life, the different sports, the different injuries, the thousands of patients I've treated. Like, this is monumental, and I'm here with you. I'm going to spread the word. On Monday, we're going to be meeting with all of our therapists and teaching them about Blister Plus and the options and the value it's going to bring for our patients. But we are going to spread this. This is incredible. And I'm on the board of directors for the state of Utah for our profession. We're going to make sure every PT knows. This is incredible stuff. So thank you for advocating for the people that are healthy, people that are out being active, doing the right things, because sometimes they feel that they're punished for doing the right things.
Yep.
You know, and this is just something that really speaks to my soul, that you're out there to help. You're out there to keep people active, keep people on the hill, living the things that they love to do, you know, and truly living the life they always wanted. So thank you for what you're doing and what you've created. This is absolutely crazy. This is so cool.
Hey, man, I appreciate it. And I think your enthusiasm about it is precisely because you do treat the people we're talking about. You see them. You see the financial impact on these people. You see them wanting to get the right treatment, to get back out there, not forgoing treatment that leads to all kinds of real significant issues down the line. So I think somebody listening to this is like, why do these guys care so much about this? It's like, it is very much one of those things. The more you know, the more it's like you understand the problem, and you understand how good of a solution something like this really is. So I appreciate that. And I think PTs like you, surgeons like you, who are really familiar with the whole system and how this works, we're seeing them become some of our most vocal supporters and advocates, because they see it serving as a real solution for the outdoor community.
Yeah, absolutely. Jonathan, thank you so much for your time. Thank you so much for all the effort, the heart that you put into building these systems and building a system that is actually benefiting the consumer. Like, seriously, man, I can't imagine how much heart you've put into this, how much effort it's taken to get to this level. But we're gonna do our part to get this out to the community. And seriously, thank you so much for what you're doing.
Thank you, Brad. I've really enjoyed the conversation.
Appreciate it.